Estrogen. You are a cruel mistress. It's traditionally thought of as the female sex hormone, but actually, we need it as well. We don't need too much, we don't need too little. Just like Little Red Riding Hood, we need just the right amount. So, what's the problem? Well, we are prone to aromatization as a society. Plastics, toxins, pollutants, liver dysfunction, obesity. These are all issues with our modern society. We are so far removed from hunter-gatherer. We have energy-saving devices. What are you saving energy for? Do something, move, be active. Oh, I'm going to treat myself. I'm going to treat myself every day with a sweet. Oh, I'm going to eat too much. Oh, it's lovely. Oh, less is more is less. I'm just so confused. We are fed so much misinformation, so much rubbish. Just move more. You'll be fine. Diet is the big one. Exercise is actually quite an insignificant component of losing weight and overall health. It is obviously incredibly important, but my God, you are what you eat. That's actually true. What you put in your body is you're feeding your cells. Your cells are constantly replicating. So if you put junk in your body, funnily enough, you will feel like crap. Because you are an animal. Remember, you're an animal. No, I'm a human being. No, you're an animal. You should be eating natural nutrients. I count my macros. I count my micros. I should be healthy. Well, it isn't even as simple as that. So, you've got your whole school of thought of calories in, calories out. Oh, I'm vegan, so I must be super healthy. B12, your essential amino acids. I'm pescatarian, so I must be healthy. Okay, well, you do your best, okay? But even your best it's hard to be actually really healthy in this modern civilized world, because we are constantly exposed to pollutants, toxins, etc., etc. Our lifestyles are not how we should be living. I mean, it's not rocket science, is it? Sat down all day in a desk job, not moving, not using your testosterone how it's supposed to be used. There's no fight or flight anymore. Everything's health and safety. Don't do that, that's risky. We need to expose ourselves to some risk. If you have a job that's stressful, but it's a stressful job sat down, you're having all those catecholamines, adrenaline floating around your body, but you're not utilizing your body, and it just doesn't make sense. This whole thing is, our whole world is unhealthy, safe but unhealthy. What do we do when we're teenagers? We go out and we party, which is always great fun. But I mean, the long-term health consequences of partying are obviously negative. In your 30s, you go, oh no, shit. I better start looking after myself. So start eating right and start doing triathlons and start doing Tough Mudders and all that sort of business. So you kind of do at least seek that dopamine response that you had through doing naughty things in your early 20s, through at least using your bodies, But is it too late? Well, it's never too late. But wow, the potential hormonal disruption that you have from leading an unhealthy lifestyle in your 20s, due to, dare I say, it's not your fault. The reality is, this society, business is, it's designed to feed the business model. It's not designed to make you healthy or keep you healthy. Our modern medical model it's a sick care model, prevention. If we were all super healthy, eating right, sleeping right, no stress, what would happen to all these drugs that the pharmaceutical companies are producing? Then look at hormonal health. Wow. And then what would happen if we corrected everybody's hormones? Nobody would need the blood pressure tablets. Nobody would need diabetes tablets. If the message was out there that you needed to have a healthy lifestyle, eat properly, exercise properly, and rather than it be a throwaway comment, if it was drilled home, boom, 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 forget the escalator, forget McDonald's, that's all garbage. If that actually happened and we started being healthy, oh dear, the shareholders wouldn't be very happy, would they? So there's a lot invested in keeping this model, all this status quo, because we don't want healthy people, because it's not good for business. So, slight tangent, not really, estrogen. How do you decrease estrogen? Well, you need a super healthy liver, and we pollute our liver constantly. Artificial chemicals, medications, fat because of excess alcohol consumption, being obese. People have a secondary fatty liver. Ignoring actual pathologies to the liver that can cause an increased expression of the aromatase enzyme. Most of the issues that we face through excess estrogen are our own fault. It's the truth. But you should go tell everybody, go live in the country with your missus and 2 children, your dog, and grow your own vegetables and hunt your own food, and don't expose yourself to the internet and all that blue light that's causing all these problems, and be more natural, go to bed when it's dark, wake up when it's light, remembering you're an animal. But it's not practical, it's not realistic in this modern world where money is the currency. It's the only currency. It's where everything's based around. So you can do your best, and you should do your best, because nobody else is going to do it for you. So a super clean diet, high in micronutrients such as glutathione, that you can find in NAC in your diet, as a supplement, and it's obviously in meats, and also we offer it in the IV nutrition thingy, so yes, it's a matter of eliminating pollutants, whether that be from your diet, minimizing exposure to plastics. Most plastics obviously have BPA in it, which mimics estrogen, so it's a hormone disruptor. Soy, wonderful, awful soy. There are so many things that you can do to decrease estrogen, that you should do to decrease estrogen, that we don't do, because there's not enough. There's not somebody there saying, do this, do this, do this. We're surrounded by temptation. We're surrounded by things that seem unavoidable, like plastics. So excess estrogen, how does it make you feel? Well, it makes you feel anxious. That is the cardinal symptom of excess estrogen. Physical symptoms include of water retention, which is especially noted around the face and around the ankles. What else? Breast issues. Everybody knows about breast issues. Bitch tits down the gym. So that's breast tissue swelling and nipple tenderness. It's actually really rare, but it's obviously something that's quite disturbing, and it's probably the one thing that everybody associates with excess estrogen. So interestingly enough, if you do get gynecomastia, the commonest medical treatment is tamoxifen. At the Men's Health Clinic, we do actually have access to DHT cream. I believe we're probably the only clinic in the UK that's got access to it. The only downside to that is it's pretty steep from a cost perspective, but it's a lot less expensive than surgery. So if you do let your gyno go untreated, that might be your only option. But you shouldn't be letting gyno go untreated. You should be contacting your prescribing clinician to advise them you're having issues, and then they can act accordingly in your best interests. So high estrogen. The bugger about high estrogen is it's quite insidious. So unfortunately, there's a massive cohort of I don't mean that, actually. I mean men walking around with high estrogens. Do they know they've got high estrogen? And the answer to that is no. But if they're irritable, worth checking your estrogen. But I don't have any other symptoms. But yeah, I tell you what, there's an unfortunate number of guys out there with a relative high estrogen to testosterone because of this increased propensity to aromatization. Now that high estrogen feeds back to the hypothalamus to trick the hypothalamus into saying, well, you've actually got enough testosterone. The negative feedback system from the HPG axis is far more complicated than that, but the cardinal factor that influences the hypothalamus sending GnRH to the pituitary is estrogen. So there are lots of guys out there who don't feel amazing, who are within normal limits, but they have a relative high estrogen. So the first thing that you should be doing is making sure you have a super clean, healthy diet, high in micronutrients to help feed the liver. You need to avoid alcohol. Alcohol, as much fun as it is, it's an absolute poison. So society is based around alcohol. Celebrate, drink. Commiserate, drink. Go out with your mates, drink. Everything's surrounded by alcohol. Every soap opera, I don't watch soap operas, but I believe every soap opera is essentially surrounded by a pub. What, EastEnders, the old Vic, New Vic, old Vic. So yeah, everything's surrounded by alcohol. So don't be fooled. Alcohol is a poison. It's great fun, but it's a poison. I packed up booze a couple of weeks ago, and I feel amazing. I do feel really good, actually. Why did I pack up booze? Well, I've been drinking heavily not heavily. That sounds bad. I've enjoyed a drink since I was 18. I've had periods where I haven't drunk for 6 months, but most of my life I've had a few too many. But I was waking up every Sunday morning after a bottle of wine with anxiety, really bad anxiety at 3 o'clock in the morning. Horrible. I really enjoy Saturday nights. So it was like risk benefit. Not feeling wonderful Sunday, not feeling wonderful Monday, picking up Tuesday. Yeah, time to stop. Sick of it. Absolutely sick of it. And it's not for me. Is it not for me forever? I don't know, but we'll see. I've got a bit of an addictive personality, so it's all or nothing with me, baby. So I'm going to abstain for a month and see if I can make that 2 months, perhaps 3 months. and then just enjoy alcohol as it's supposed to be enjoyed occasionally, because it's poison. It's a shame because it is fun, but it's poison. So what have we said? Clean liver, no alcohol, medications, minimize medications. Obviously, if you're on a prescribed medication, take the prescribed medication. But again, it's a risk-benefit discussion that you need to have with your clinician, and hopefully not on a medication inappropriately. That would be a bit worrying, but I'm sure some of you are. And body fat. So body fat's interesting because obviously we all have our ideas about what's best, what diet's best, calories in, calories out, keto versus keto. Good for losing weight, not long term, in my opinion. Again, I'm not a nutritionist, but the reason why I don't like keto long term is because obviously your brain likes glucose, okay, and diabetes. So we do need glucose. The liver will convert protein into carbohydrates through gluconeogenesis. So it's got a safety mechanism. So it knows, it's like, hell, you're not giving me glucose. So I will create glucose from protein. And most of you guys who think you're in ketosis are in ketosis. You're having too much protein and your liver is working and creating glucose through gluconeogenesis. Why are all these terms so complicated and long? It's so the weeks can't say them. So your body has a protective mechanism to make sure you have some glucose. So my personal favourite diet for long-term health and hormonal health is low carb, high fat. So estrogen, high estrogen. How do we control estrogen at the Men's Health Clinic? Normally, it's dose adjustment, interval adjustment, method of administration adjustment, so IM to sub-Q, and if that doesn't work, and obviously lifestyle, because you should be doing that. I can't cure you if you still lead an unhealthy lifestyle. I can optimize your levels, but I can't make you feel great. So the ball's in your court, okay? So you need to work with me. So some of the guys who prescribe testosterone use anastrozole. It seems to be the commonest used drug. I don't use that. I think it's garbage. We use exemestane, which is a suicidal inhibitor. The reason why we use exemestane is because it's a suicidal inhibitor. So there's no rebound. Essentially what we are doing is we are knocking off a bit of the aromatase enzyme, so the testosterone does not get converted to estrogen. Makes sense to me. Knock off a small proportion of the aromatase enzyme. It's not rocket science. So we microdose exemestane. Perhaps that's where the other guys go wrong. They give too high doses. So again, the body likes you to take things slow, baby. Logical and methodical approach. So we have a logical and methodical approach, and we microdose exemestane, and we have had brilliant results from doing this in lowering estrogens. So what happens when you have somebody with a high estrogen and you give them exemestane? So obviously their estrogen goes down, but also you need to consider whether the free testosterone and DHT are going to rise too much. You don't have to worry too much about the DHT, to be fair, because there's always a relative decrease in DHT, because obviously the 5-alpha reductase enzyme that converts testosterone to DHT is highest around the prostate. So if you're looking to optimize your levels, which is what you should be doing, through exogenous testosterone that's administered either intramuscularly or subcutaneously, then you will have a relative decrease in DHT. It's also one of the reasons why we have HCG is actually because not only for the other benefits that you should all know about, hopefully, the natural production of testosterone would obviously will be exposed to 5-alpha reductase. So you would actually get a little bit more DHT from having HCG in your protocol. See, method behind the madness. It's not just fertility. There are other important roles of HCG. So HCG should be in your protocol. So yeah, you have to understand that if you've got optimal free testosterone levels and you've got elevated estrogen levels and you add in an AI, that testosterone that was being converted to estrogen previously is no longer going to be converted to estrogen, so it's going to be converted to free testosterone and DHT. So often guys go, why are you decreasing my total testosterone dose? Well, because that estrogen is no longer being converted, so you will have a slight spike in free testosterone compared to the previous blood test. So again, logical and methodical. So you do have to take that into consideration. So fine-tuning, it's all about fine-tuning and finding a level that's correct for you. What else do you need to know? What happens if you drop your estrogen down too low? Now we don't ever crash estrogens. The only people that ever crash estrogens have not followed my instructions. So we know that people feel best, and this is anecdotal, between about 90 and 120, but they mostly like to be about 90 or around that number. So if you're dropping down to 60 and everything else is optimized, what do you do? Because you're struggling with making any more refinement to the dose of examestane, because those little buggers are hard to quarter. Although we do actually have a compounding pharmacy that is doing us 1 milligram capsules, but we need to negotiate price because it's quite expensive. So if you do have a borderline low estrogen, then what do we do at the Men's Health Clinic? We tinker with your HCG, because everybody knows that HCG spikes estrogen, okay, but not if you adopt a logical and methodical approach. So guys with borderline low estrogens, I've often increased their HCG from 100 IU daily, if you're on that protocol, to 120. So it's not going to cause a massive spike in your testosterone, but it will create a slight spike in estrogen to hopefully bring it up to a nice therapeutic level that you feel the benefits of having an optimal estrogen. So it all sounds simple, complicated, I don't know. It's quite simple to me, but it is quite complicated. And the fact that there is fine-tuning means that it really shouldn't be done by you. We are our own worst enemies. So as you know, obviously we don't advocate self-medicating. But people think, oh, I've been on the internet, or I think I know what I'm doing. It's really hard. It's not only do you need to have an understanding of physiology, etc., pharmacokinetics, etc., we're our own worst enemies. We really are. And so you need somebody that can be objective and actually work in your best interests. We've discussed this many times before, you know, everybody chasing numbers. You know, I'd much prefer to, when I see my guys, unfortunately they've always had bloods done, but I don't talk about their bloods until I've spoken to them and found out how they are. And it's only then that I actually look at their bloods to go, okay, right, now let's decide where we go from here. Because everybody is influenced by numbers, and I know where I want you, You think you know where you want yourself. Those numbers don't always match up, but I tell you what, you're a human being, and despite testosterone levels dropping, and they are dropping, reference ranges are decreasing, which is alarming because it just reflects essentially that we are living in a sick society. You're normal in a sick society, which is quite alarming. So I know where I want you, and through experience, those numbers are pretty consistent to actually feel that qualitative benefit. Obviously, there is that sort of T to E ratio discussion that obviously a lot of guys have, and I feel great with a high free testosterone because my estrogen's also slightly elevated. Yeah, it's interesting because I don't think that's sustainable. I don't mind my guys up to about a free testosterone of 1, but I do think above that you are looking at potentially a decrease in your HDL and issues with your hematocrit. So I quite like my guys to really think about less than 1. And we've had a lot of alpha guys who have been up at 1 and said, oh, I need to be higher, doc, look at me. And we've reduced their dose, and actually their erections have got stronger, their sense of well-being has got stronger. Because we want you to be calm on testosterone replacement therapy. We don't want you to be hyper, because calmness is good. Calm, confident, cool, collected. So we've slightly gone off on a bit of a tangent, which is obviously how my brain works. Estrogen. She's a cruel mistress. She needs to be treated with respect. And there's obviously some people out there that think that you don't need to actually address estrogen. You really do. You really do. Not only because of those symptoms that we've discussed, like anxiety, water retention, bloated, breast tissue swelling, etc. Prostate cancer. Prostate cancer is growing. Now, why is it growing? Is it because of the unhealthy world that we live in? Is it because there are more people who will be looking for it? Blah blah blah. No, testosterone traditionally drops with age. Normally, in a healthy population, that estrogen would also drop, but because of our propensity to aromatization, we are seeing lower testosterones with a relative high estrogen, and I believe that to be a causative factor in prostate cancer, and there's growing evidence to support that. I do have a guy who's got prostate cancer, who's under the oncologist, and the oncologist is happy for me to treat him with testosterone replacement therapy as long as I control his estrogen. So there's growing research or data to suggest that estrogen is the big player. So you need estrogen, not too much, not too little, just right. So yeah, have a good day, guys. Ta-da.